Good afternoon. My name is Garth Reynolds, the Executive Director for the Illinois Pharmacists Association, and thank you for joining us for Illinois Pharmacy Legislation Review. In this short program, we will discuss the pharmacy-related legislation from the first half of the 2018 session of the 100th General Assembly, and we will discuss the status of IPHA-sponsored legislative initiatives for 2018. First, let's do some overview of the Illinois Pharmacists Association. Our mission statement of the Illinois Pharmacists Association is dedicated to enhancing the professional competency of pharmacists, advancing the standards of pharmacy practice, improving pharmacists' effectiveness in ensuring rational drug use in society, and leading in the resolution of public policy issues affecting pharmacists. Our vision statement is that we are the voice for pharmacy in Illinois. IPHA is fortunate to represent pharmacists in all practice settings throughout the state of Illinois, including pharmacy technicians and student pharmacists. IPHA is the largest and oldest statewide association in Illinois, and we were founded in December of 1880. One of the very first membership circulars stated, "Druggists of Illinois, elevate your profession and protect your business." And this was true in October of 1880 and is still true today in April of 2018. And we accomplished this through many different aspects of affecting your practice and advancing patient care. And we do this by developing professional development programs and enhancing your competency, monitoring legislation and regulation and influencing the decisions and how they may impact your practice. Also working with members of the community to inform them and educate them about the value of pharmacists. Helping with promoting research and collecting information to further the practice of pharmacy. To bring pharmacists, student pharmacists, and technicians together from all across the state so you can network and learn each other's practices and how best you can approach your practice and your patient care. And of course, by fostering high standards of ethical conduct and developing best practices for the profession. And of course, working with not only other pharmacy associations, but other healthcare pharmacy and other non-pharmacy stakeholders in advancing the practice of pharmacy and improving the delivery of patient care. But today we're going to be focusing on one of the main functions of the association, that is political advocacy. IPHA monitors state and federal legislation and regulations that may impact the profession. And we represent our membership and the profession by educating and discussing positions not only with key legislators but also regulators. You can look at our legislative tracking report in real time at IPHA.org. This is a picture from the 2015 Illinois Pharmacy Legislative Day, and it's just an example of what can happen when pharmacists, technicians, and student pharmacists come together to advocate for their profession. Now let's look at an overview of the 100th General Assembly. In the 100th General Assembly, both in the House and the Senate, the Democrats have majority, with 37 Democrats in the Senate to the 22 Republicans, and 67 Democrats in the House to the 51 Republicans. In the Senate, the Democrats have what's called supermajority, which means that the Republicans can all vote for or against a bill, and it cannot affect the ultimate outcome. Currently in the General Assembly, there are 9,459 bills under consideration that have been introduced, and 2,529 resolutions. When compared to other states, some states only deal with a maximum of 2,000 to 3,000 bills. So we do have our work cut out for us when it comes to monitoring legislation and looking at ways that any legislation could impact the profession of pharmacy and our patients. We are usually monitoring between 150 to 300 bills in any given session. And I would say in the 100th General Assembly, we are now closer to the 400 bill mark in this General Assembly. The General Assembly is a 2-year term, which began on January 1st of 2017 and ends in this December 31st of 2018. This is an example of some of the committees that we monitor the activities of throughout the General Assembly session. Because the House has more members, exactly double the amount of the Senate, they can delve deeper into various topics. As an example, if a bill that affects the Pharmacy Practice Act is introduced in the Senate, it goes to Licensed Activities and Pensions, which addresses all issues for all regulated and licensed professions and any pension issue. Where in the House, it would be assigned to the Healthcare Licenses Committee. So we see a lot of healthcare bills start out in the House because you can have that more detailed committee hearing, which may not always get that opportunity if it starts in the Senate. Here's a listing of the main departments that IPHA works with when it comes to the practice of pharmacy. The first one, of course, is the Department of Financial and Professional Regulation, which the Board of Pharmacy sits under, and we work with on any licensing issues or issues affecting the Pharmacy Practice Act and the rules for the Pharmacy Practice Act. Next is the Department of Healthcare and Family Services, or most of you know it better as Medicaid. Of course, we have extensive discussions about the way the practices and administration of Medicaid are impacting the profession and impacting patient care. Department of Human Services houses the Prescription Monitoring Program. So in addition to an IPHA representative sitting on the Prescription Monitoring Program Advisory Committee, we also work with the department in the administration of the Controlled Substance Act and providing comments and suggestions on any rule changes to the Controlled Substance Act. The Department of Insurance oversees any of the private and commercial insurances that are administered throughout the state. The Department of Public Health, we've had more interaction with them in the last 6 years than we've had in a significant number of years, but prior to that, mainly through a couple different grant projects, but also, most importantly, in the last couple of years with the establishment of the statewide standing order in naloxone, that IPHA worked hand in hand with other healthcare stakeholders with the department, and hopefully with the other expansion of pharmacy practice that we'll be talking about later on in this program. In the Department of Central Management Services, or Illinois CMS. Now this has nothing to do with federal CMS with the Centers of Medicaid and Medicare Services, but when we talk about Illinois CMS, it is basically the HR department for the state. So any state employee insurance issues or retiree insurance issues, we have to direct that through Illinois CMS. This is a listing of various acts that impact our profession that we monitor legislation. Of course, the main one's going to be the Pharmacy Practice Act and the Controlled Substance Act, but we do keep an eye on all these other acts plus any other legislation that may come back to affect the practice of pharmacy or impact your patients directly. So let's take a look at the spring session of 2018. We are just ending our spring break for the General Assembly, and they come back tomorrow on April 9th, and we'll go through, at least scheduled-wise, until the 31st of May. Let's begin our discussion with House Bill 274, or House Bill 5747, introduced by Representative Michelle Mussman of Schaumburg. This would add dispensing of hormonal contraceptions pursuant to a statewide standing order to the definition of practice of pharmacy. As you know, with this type of bill, we've had a couple different versions of this bill, with the initial one stating that pharmacists would have independent prescribing authority, and through compromise and discussions, we have moved this to a statewide standing order where pharmacists would be able, upon assessment of the patient, be able to dispense through product selection oral hormonal contraception, transdermal patch, or a vaginal ring for a patient, depending on what the patient's choice of product and the pharmacist's best professional and clinical judgment for the patient. This would require an ACPE training course to be able to utilize a statewide standing order, and would require patients to complete a self-screening risk assessment prior to dispensing. Also included in this is language that would provide for the coverage of pharmacist delivered patient care services, not only in commercial insurance but also under Medicaid. And this would help with establishing for the first time in the insurance code and under Medicaid public aid code that pharmacists should be paid for the patient care services delivered beyond just the dispensing of a medication product. And we're also glad that the requirements for the statewide standing order will be overseen by the Department of Public Health working with the various stakeholder organizations, including IPHA and the Illinois State Medical Society. This bill will be heard this upcoming week in the House Healthcare Licenses Committee, and we are hoping that it will receive a favorable due pass out of the committee and help us move forward with not only advancing patient care, but also looking at pharmacist provider status. House Bill 3285 and Senate Bill 1844, introduced in the House by Representative Robert Rita of Blue Island and in the Senate by Senator Kwame Raoul of Chicago. This bill would amend the Illinois Insurance Code and provide for increased transparency in the auditing process and provide for a balanced approach to controlled costs not only to sponsors of pharmacy and prescription health plans, but also provide establish protections for pharmacy providers throughout the state. This bill is the product of lengthy negotiations with the PBM and managed care lobby, with not only with IPHA, but with the Independent Pharmacy Cooperative and with NCPA. We are heading towards an agreed bill, and we are looking at moving the bill forward, hopefully in the coming weeks. And this bill has been in one form or another in the works since about late 2007, 2008, and a lot of that original protection language is in this bill still. And IPHA is glad to say that a majority of the language that we have wanted is still in this bill and is going to be a strong bill in protecting pharmacies in Illinois when it comes to audits. House Bill 3479 and Senate Bill 1888, in the House introduced by Representative Sarah Feigenholtz of Chicago, and in the Senate introduced by Senator Sam McCann of Jacksonville. This bill would amend the Public Aid Code. And this bill focuses on the inappropriate and under-cost reimbursements that pharmacies have been seeing under the mismanaged Managed Medicaid program. And this would establish that a fair and reasonable reimbursement rate would have to be established for pharmacy providers of not only the prescription products being dispensed, but also any pharmaceutical or patient care services delivered. It would also establish that a professional dispensing fee would have to be reimbursed, and that no claim could be reimbursed under the acquisition cost of the pharmacy. And so for the base reimbursement rate could not be any lower than what is currently enacted in the fee-for-service, or what we consider the traditional Medicaid program. So this would allow pharmacies to participate in the managed care program, but be reimbursed under the more reasonable, if we can say that, rates with the fee-for-service of the traditional Medicaid program. And so this would preserve access to patient care in our communities and preserve the operational sustainability of pharmacies throughout the state of Illinois. This bill is currently in the House in the Human Services Medicaid Subcommittee. In January of this year, IPHA provided detailed testimony to the House Appropriations Human Services Committee on the impact of this program so far on pharmacies, and the egregious practices that we are experiencing in underwater reimbursements and inappropriate reimbursements that are affecting the operational standards of pharmacy. We cannot continue to have this type of a program be run in this state. It's interesting, with a January of this year report from the Inspector General that showed that Medicaid mismanaged $7 billion between Medicaid and the managed care organizations. And this program is being balanced on the backs of pharmacy providers and other healthcare providers, and that is not how you save money for taxpayers in Illinois. House Bill 5442, introduced by Representative Jim Durkin of Burr Ridge. This would amend the Controlled Substance Act and would affect primarily reporting to the Prescription Monitoring Program. Currently, under the prescription monitoring program, hospitals and institutions do not have to report to the prescription monitoring program if the controlled substance is less than a 72-hour supply and is not considered to be a discharge medication. House Bill 5442 wanted to remove that exemption. What concerns us is this would be not only an administrative burden for the health systems that would be involved with reporting every controlled substance to prescription monitoring program, it really would start to skew the data and the data trends that have been developed in the prescription monitoring program. We would be taking it from looking at the patient's overall chronic medication use and skewing the data from an acute episode of being in the hospital. And so we've been through negotiation, have been able to remove that in House Amendment 1. But the other part that of continued discussion between the various healthcare stakeholders and the department with Leader Durkin is about the change of moving the reporting from the end of the next business day to the end of the current business day. And IPHA still has extreme concerns about the technological burden that will be placing on the prescription monitoring program. This bill is currently been assigned to the House Judiciary Committee. Now let's take a look at Senate Bill 2849, introduced by Senator Patricia Van Pelt of Chicago. And this would create the Prescription Drug Repository Act. And this is the first bill in a number of years that has been introduced to address a drug repository program. And probably one of the very first in a number of years that IPHA is more comfortable with supporting, because it actually establishes procedures for who can donate medications and supplies, how they will be accepted, and how they will be dispensed back out into the population. Plus, it also establishes the needed civil and criminal immunity protections for pharmacists and manufacturers in the program. Now, with the introduction of Senate Amendment Number 1, it does remove the civil and criminal immunity protections under the bill. IPHA and the Illinois State Medical Society is working with Senator Van Pelt in discussions with the Illinois trial lawyers in trying to come up to a compromise for this bill so we can move it forward to address the needs of redispensing needed medications out to those individuals who cannot afford proper medical care. Senate Bill 3170, introduced by Senator Steve Stottleman of Rockford. This would amend the Pharmacy Practice Act and the Food, Drug, and Cosmetic Act and would allow for legend medications, legend prescriptions to be able to be valid for up to 15 months from their date of issue and for the purpose of refills. This has currently been assigned to the Senate License Activities and Pensions Committee. IPHA is currently neutral on the bill. We have been requesting additional information of why the additional 3 months. We could understand if the recommendation was looking at extending it, but we do have concerns on how this may impact medication adherence and also the need for the patient to be regularly seen by their prescriber and or physician. Senate Bill 3431, introduced by Senator Sue Rezin of Peru. This would amend the Illinois Controlled Substance Act and would place day supply limitations on opiate prescriptions. Specifically looking at if you're 18 years or older for your outpatient for first use, you would get no more than a 7-day supply, and prohibit anyone from under the age of 18 from having on an opiate prescription more than a 7-day supply. It would also establish mechanisms for a physician or prescriber to prescribe more than a 7-day supply, but with proper documentation and indicating that non-opiate alternatives were not appropriate for this patient's condition. IPHA remains opposed to this legislation in its current form. IPHA continues to be against any legislation that we feel would increase barriers to access for patients to appropriate medication therapy. We are very active in the opioid epidemic realm and working on solutions to this issue that is impacting our state. But we are also very concerned about the creation of a stigma towards patients that legitimately have chronic pain and deserve to not have barriers to their treatment. This bill is currently in the Senate Public Health Committee and is considered to be up for hearing in a couple of weeks, along with a couple other pieces of legislation concerning opiates. House Bill 4650 concerning the Prescription Monitoring Program and would amend the Illinois Controlled Substance Act. This was introduced by Representative Mike Zaleski of Riverside and would alter the definition of pharmacist under the Prescription Monitoring Program to include pharmacists associated with health maintenance organizations or Medicaid managed care entities providing services under the Illinois Public Aid Code. This bill is still under considerable negotiation between IPHA, the Illinois State Medical Society, and the Illinois Association of Medicaid Health Plans. IPHA is opposed to the bill in the current form. We have extreme concerns about any healthcare professional who does not have a direct patient care relationship having access to the prescription monitoring program. Remember, in Illinois, the prescription monitoring program is a clinical reference tool and is to be utilized by the healthcare practitioners in direct patient care with the individual, and not to be used for any type of outside reporting or trends analysis in respect to the patient or their prescriber or their pharmacy. So IPHA continues to have active negotiations with the respective stakeholders on this bill, and it is set for hearing in House Healthcare Licenses Committee. House Bill 4907, also concerning the prescription monitoring program, introduced by Representative Michael McAuliffe of Chicago. And this would amend the Controlled Substance Act and would allow for licensed and non-licensed designees in a prescriber's office or licensed pharmacy personnel who have at least received HIPAA training to be able to be designated as users for the prescription monitoring program. This would also establish that a dentist would be added to the prescription monitoring program peer review subcommittee, which currently has 3 physicians and 2 pharmacists that sit on that committee. The reason for this bill comes from this Illinois State Dental Society and wanting to ensure that designees or users in the healthcare practitioner's office can be assigned in the aiding of looking up patients for the review of the healthcare practitioner. And House Amendment 1 preserves that pharmacies would be able to do that with our licensed personnel and not limiting us to those that were employed by a practice. So we were wanting to ensure that student pharmacists who are on rotations would be able to utilize the prescription monitoring program in the appropriate use in utilization in practice. This bill is currently in the House Human Services Committee. House Bill 4707, introduced by Representative Sue Shira of Decatur. This would amend the Illinois Controlled Substance Act and reschedule hydrocodone in all of its forms from a Schedule II controlled substance to a Schedule I. Of course, you can imagine the immediate impact and extreme barrier to care that this bill would create. IPHA had extensive discussions with the representative about the impact on patient care and the limitation of treatment options that this bill would cause. And we understand the representative's concerns on the current status of the opioid epidemic, and IPHA, along with other healthcare associations and stakeholders, worked with the representative to move the focus away from rescheduling of hydrocodone and instead establish a prescription drug task force to review this issue more in-depthly. And this more pulls the legislation in line with the Illinois State Opioid Action Plan, which IPHA was an active participant in its creation, in establishing 9 strategic action steps for the state to take a look at over the next 3 years in reducing opioid overdose deaths by 33%. This bill did pass out of committee and is currently on second reading in the House. House Bill 4900, introduced by Representative Will Guzzardi of Chicago, is wanting to address the issues of generic pricing and would create the Illinois Generic Drug Pricing Fairness Act and would provide that manufacturers and wholesalers shall not engage in price gouging. This would also provide that the director of HFS and CMS could notify the Attorney General of an increase of a medication that may be considered to be price gouging. It would also allow the Attorney General to have reason to believe that a manufacturer or wholesaler is participating in price gouging, could be sent a notice, and could have further repercussions if the action was not resolved. This bill is currently being held on second reading. It did pass out of committee. IPHA has remained neutral as to the current version of the bill does not directly impact pharmacies or patients, but we are concerned that if this legislation would financially punish or take extreme legal action against manufacturers and or wholesalers, that of course that this could cause the rise of medication prices overall, which kind of defeats the purpose of the legislation. So we are continuing to monitor the progress of this legislation. Senate Bill 2889, introduced by Senator Chapin Rose of Champaign, creates the Epinephrine Administration Act, and it would provide that a healthcare practitioner may prescribe epinephrine pre-filled syringes in addition to auto-injectors. And so this bill is amending aspects of not only creating the Epinephrine Administration Act, but also amending segments of the school code and allowing schools to have other more price reasonable or cost-effective options from the epinephrine auto-injector, which we know had a lot of focus last year and a little bit the year before that, and its extreme price increase over the last number of years. And this would allow other options to be made available to schools and other facilities and for self-care. This bill is currently in the Senate on the order of second reading. And IPHA has been supportive of this bill and assisting with providing technical assistance on the use of other epinephrine dosage forms. Senate Bill 2524, introduced by Senator Chapin Rose of Champaign, would initially have amended the Department of Public Health Powers and Duties Law of the Civil Administrative Code of Illinois, and that would require public health to initiate a review and recommend new state laws for the disposal of unused antibiotics. The goal of this legislation from Senator Rose is to take unused antibiotics out of the system to decrease the chance of resistance increasing in our communities. The senator, after discussions not only with IPHA but other pharmacy and healthcare stakeholders, has amended the bill to create a pharmaceutical disposal task force, which we would be a part of in addressing the overall concern about trying to get unused medications out of the system and properly disposed in an environmental safe way. So this bill is currently on the order of second reading and should be progressing forward here in the coming weeks. Senate Bill 3015, introduced by Senator David Keeler of Peoria, and this would amend the school code in the same way that epinephrine was amended a couple years ago in legislation sponsored by IPHA. And IPHA is also in support of this piece of legislation that would allow not only for the self-administration but the self-carry of asthma medications in schools. And this bill currently is still assigned to the Senate Education Committee. House Bill 2511 and Senate Bill 2827, both addressing Medicaid exceptions to the 4-drug limit under the SMART Act. In the House, introduced by Representative Sarah Feigenholtz of Chicago, and in the Senate, introduced by Senator Laura Murphy of Elk Grove. And again, this would provide that for medications prescribed to residents of long-term care facilities would not be subject to the 4-drug limit. IPHA has been a long supporter of this piece of legislation in previous forms, and we continue to be a strong supporter of this legislation. And this House Bill 2511 did pass out of the Appropriations Human Services Committee this past week, and we look forward to seeing the progress of that legislation. So that was a quick review of some of the major pieces of legislation that are currently still moving in one form or another. But again, not an overall review of all the many hundreds of pieces of legislation that IPHA is monitoring. But we do want to kind of talk quickly about some of the overall legislative and regulatory initiatives for IPHA. And 2018 has been a very busy year. As you remember, last year we had negotiations on legislation that would limit pharmacy workload limits and the number of prescriptions per hour for pharmacies. Well, the results of that legislation created the Collaborative Pharmaceutical Taskforce. And we have a 2-year charge to not only address the concerns in that piece of legislation, but also to look at the overall advancement of pharmacy practice in looking at what our Practice Act needs between now and 2028. So IPHA is currently active in that task force along with other pharmacy and healthcare stakeholders. We've already discussed the active negotiations in our audit piece of legislation, which is a key piece of our managed care and PBM reform, in addition to the current activity in our managed Medicaid reform piece of legislation, which again would remove reimbursement rates from the current underwater rates that managed care organizations and PBMs are implementing to moving it back to traditional fee-for-service. And we hope with elements of the contraceptive bill that could pass could actually help us achieve some of our state level provider status goals. But in addition to that, IPHA is continuing to work with sponsors in the development of legislation to address the increased robberies and burglaries throughout the state, and looking at increasing punishments and the penalties for breaking in or holding up a pharmacy. In addition, on the legislative front, IPHA has provided recommendations on upcoming revisions to the Pharmacy Practice Act administrative rules, specifically in the area of compounding. And we hope that process will be completed by this summer for implementation later on this year. And this has been a multi-year negotiations, and IPHA, specifically our compounding section, has been very active in crafting this language so that it helps with maintaining access for patients to compounded medications in the state, at the same time trying to decrease or at least minimize the regulatory burden placed on pharmacy practices. And again, we are very thankful to the International Academy of Compounding Pharmacy that assisted us also with suggestions and review of the recommendations for the administrative rules. Now let's take a look at how to contact your legislator to help inform them of IPHA's position on various pieces of legislation, and to also provide support for IPHA's initiatives. So the best way to have an impact with your legislator is to meet with them face to face. And if you do have the opportunity to set up a meeting or be at an event where your legislator is attending, just remember to introduce yourself and state why you're there. Again, be polite. Remember, mention any mutual friends or contacts that you may have with them, and emphasize the key points that are personally concerning to you with that piece of legislation. But try to keep your discussion brief. But also remember to expect questions and be responsive. Do not engage into an argumentative debate, but be brief about your key points and supportive material. And also be enthusiastic and show how much you care about the issue. And if possible, try to get a commitment of support. Specifically, if you're looking at, let's take an example, House Bill 3479 on our managed Medicaid bill, you know that your representative is saying that they would either support or sign on as a co-sponsor. Please let IPHA know so that we can follow up with that representative. But also, most importantly, follow up with a thank you letter or even an email saying, even if you weren't successful, just thank them for their time and for listening to you. Because remember, we only have one healthcare professional currently in the General Assembly, and that individual is a nurse practitioner. But before her appointment in the fall, we had not had a healthcare practitioner in the General Assembly for a number of years. So most of the members of the General Assembly have a law background, and so they don't quite always understand how the proposed legislation will impact pharmacy. So they really do look to the association and also to you to help with informing them of how that's going to impact your practice. So this is why we encourage, in addition to IPHA advocating on behalf of the association, but also you getting involved and working with your personal legislator and talking with them about how this is going to impact your community and their community. Again, when you're communicating with legislators, you don't always have the opportunity to have a face-to-face meeting. So if you're deciding to write a letter or an email, please take a look at these points. Clearly identify the subject that you're personally interested in. So make sure to talk about which legislation you're talking about, whether it's a House or Senate bill. Explain how your business is relative to this issue. Again, write legibly and briefly. Please talk about your personal experiences to this issue and use your own words and, if possible, on your pharmacy stationery. But do try to restrict yourself to one issue. There are many issues that we discussed, and a lot of them have a lot of impact. But again, try to be issue specific on each communication. Again, you can also write to committee and subcommittee chairmen responsible for the legislation that can help show support for IPHA's position on a respective piece of legislation. So again, do be active, make those phone calls, type out those emails, write those letters, post on social media. Those do have an impact and help elevate our overall voice for pharmacy in Illinois. Now let's look at some don'ts. Please do not be rude or threaten the legislator. That'll get you in trouble. But do not pretend to have any greater political or even professional or personal influence greater than you have. Do not promise anything that you cannot deliver upon. Do not be self-righteous or all-knowing. Don't be vague about the issues. A lot of our healthcare and pharmacy issues are complex and do take some detailed description of how this will impact your practice and affect your community. And again, please don't forget to thank them for their time. And do not bring past campaign contributions or present a check during any meetings that you have. Those need to be done specifically through the avenues of their campaigns or specifically at fundraising events. Here are some references that will help you if you wish to take an extended look at any of the legislation that we discussed today. And just remember, be an advocate. Be that point of contact and education for your community. And by doing so, you also need to stay up to date, not only with the current legislation being proposed, but also with legislation that's being enacted or has been enacted, and updating your practice accordingly. And then most importantly, maintain your membership with IPHA. The Illinois Pharmacists Association's voice is only as strong as the members who support us and are a part of us, because together we are stronger. We can advance the practice of pharmacy and impact directly the quality of patient care in Illinois, but that only happens with your support. If you have any questions or concerns about any of the legislation that was discussed today, please do reach out via email or phone that's listed here. But do go to IPHA.org and take a look at the legislative tracking report so you can take a look at all the legislation that IPHA is currently monitoring. In addition, there are advocacy talking point sheets for the advancement of access to contraception bill, the audit reform bill, the reimbursements for managed Medicaid bill, and the restrictions under the prescription monitoring program. In addition, do take a look on social media and like us on Facebook and on Twitter. You can follow us on Twitter not only for the association, but also our annual meeting, which is coming up September 27th through the 30th in Lombard, Illinois, and also the Foundation and the Illinois Community Pharmacy Enhanced Network. Please consider joining that network to not only provide increased opportunities for care for your patients, but in enhancing and exhibiting to those stakeholders that pharmacists are the medication experts and can deliver and improve patient outcomes in their communities. Do follow us on Instagram and also on YouTube, where we'll be posting similar programs to this and also a new podcast later on this year. But again, my name is Garth Reynolds, your Executive Director of the Illinois Pharmacists Association, and I thank you for taking time today to learn more about your profession and advance care in Illinois.